Just let us wait a few more 1-2 minutes before everybody else also joins the discussion. So we are going to have anesthesia quiz now shortly. I hope the quiz link is there with all of you. Just give 1 to 2 minutes time before everybody else will join. With a lot of comrades joining the game, let's make it all happen. I hope you're all ready for the fight. Let's start. So there are 46 questions in this quiz. 12 seconds short time is being given to you, and you need to really fight it back. Short daycare surgeries. What is the combination of anesthetic agents which are being preferred? So you should know it is the propofol, alfentanil, and isoflurane are the ones which are being administered. One of the favorite questions. Good. Ramesh, Durga, Anil make their great beginning. Question number 2. Intravenous induction agent which is used most commonly for the daycare surgery is which one? Which is that which you use? Intravenous induction agent. Very good. Almost most of you are right. It is the propofol, which is also called milk of amnesia, because it is white milky fluid that you find. That's good. Number 3. So what is the best indication for propofol as an intravenous induction agent of all the various indications of the propofol? Very easy question. I'm very sure all of you will crack. Good. That is daycare surgery is the one. So we have good to see KK, SK, Raj, Sudarshan Mahanta, Arul, Ashu, many more who have joined the quiz. Very good, doctor. So to study alone is a very boring job. When we have a company with some quizzes, revision sessions, that makes the learning interesting. The last molar to general anesthesia daycare case and he wanted to resume the work immediately within 6 hours. What is your answer, doctor? Once more, you should emphatically say propofol is the king. Question number five. Five. So, alfentanil, propofol, midazolam, mivacurium. Mivacurium is the muscle relaxant of choice for the daycare surgery. Please don't forget. Similarly, isoflurane also is used in the daycare surgery. Very good. So, the best anesthetic agent for the outpatient analgesia is alfentanil is the name that you need to remember. So whenever daycare surgery, OPD, analgesic of choice, you should answer alfentanil is the drug that you need to remember. Now, a 6-year-old elective urological surgery. So you should know what are the agents used for coronary artery surgery, neurosurgery, and in the neonates. In the neonates, always the preferred induction agent, please don't forget, is sevoflurane, is what you need to remember. So always children, pediatric population means पीडियाट्रिक होता है शिशु, लिटिल चाइल्ड, शिशु, शिशु बोलते ना हिंदी में, तो शिशु के लिए सिवोफ्लुरेन इज द बेस्ट थिंग. दैट्स व्हाट यू नीड टू बेसिकली रिमेंबर. Good, very good, very good. Good to see 11 players. I want at least 40 to 50 players in the quiz. There is intestinal obstruction, deranged liver function. What is the anesthetic of choice? So you should be very sure. Liver disease, what is the agent that we use? Intestinal obstruction, yes. Once more, sevoflurane is considered to be the anesthetic of choice whenever there is a deranged liver function, is what you should remember. Good. Only Ramesh answered correctly. Rituraj, SK correctly answered. Good. Now, the question number 8. So, 2-month-old infant, you would avoid which anesthetic? Which anesthetic do we avoid is a very important question. For a 2-month-old infant, very good, very good. So, it is the halothane which is avoided in a pediatric 2-month-old infant is what you should remember. Excellent. Durga, JD, Ramesh have correctly answered. Question number 9. Yes. So, if you look at the various halogenated anesthetics, the one which has maximum incidence of hepatitis, always remember methoxyflurane more than enflurane, more than isoflurane, more than desflurane is what you need to remember. So desflurane and sevoflurane, least possibility of developing hepatitis. These are all the agents given for induction except morphine in case of the children. Very good. So Sudarshan, Mahanta, and R is able to throw some good emojis also. Very good, very good. So excellent, excellent, doctor. So Durga is leading on the top. Question number 10. The narrowest part of larynx in infants is at the cricoid. So, what is the important thing while administering anesthesia? Anesthesia, because of this. So, you should remember because of that narrowest part being at cricoid, there can be trauma to the subglottic area. Post-operative stridor is more common in infants. Laryngeal edema can be dangerous in case of the infants. They're all the true statements. Wow, good to see Subramaniam, KK, everybody else joining. So please remember, doctor, we also have a live session which is happening uh, in the video chat room. So on the mobile you can answer, and on the laptop you can have this video interface. You can join the video room. That way you can feel like a real classroom. In fact, more effective than real classroom. All right. Question number 11. So every day, in fact, we are planning to increase the length of sessions. Morning 10 o'clock to night, midnight 12 o'clock. We are going to have every hourly a session where MCQ discussions, topic reviews, quiz tournaments, they're all conducted. So please be very sure to be part of our WhatsApp group. Inform all your classmates, share them the WhatsApp joining link, let them join and enjoy a very proactive preparation together. On every Sunday, we will also have grand tests and also discussion on the grand tests. Okay, so doctor, if you look at the general anesthesia, very good. So the next question, question number 12. Question number 12. A 2-month-old has undergone a major surgical procedure. Post-operative pain relief, what do you want to give in a pediatric patient is a very important question. Post-operative analgesia, very good. Intravenous narcotic infusion in low dose is considered to be the recommended way of treatment is what you need to remember. Good. Now, doctor, question number 13. A 5-year-old strabismus correction. Induction is uneventful, but after the conjunctival incision, the anesthesiology looks at cardiac monitor. So, why do you think he did that in strabismus surgery? So, there is something called oculocardiac reflex. Whenever you are doing an ophthalmic surgery, there is a great risk of developing a cardiac arrest because of the oculocardiac reflex, is what you have to emphatically remember. Very good. So, Durga is strongly maintaining her domination in answering the questions correctly. Very good, Dr. Durga. A 6-year-old boy schedules for examination of the eye under anesthesia. And which drug you definitely avoid? Very, very interesting question. So it is the succinylcholine. Succinylcholine is what you need to remember. So that need to be avoided. Most of you have gone wrong when it comes to this question. Now, question number 15. 15. 5-year-old boy, Duchenne's muscular dystrophy, undergoing tendon lengthening procedure. In them, what is the anesthesia of choice? Is the favorite question of the examiner. Yes, doctor. So, induction by IV propofol and maintenance by nitrous oxide and oxygen is best choice in case of Duchenne's muscular dystrophy is what you should remember. Excellent. Jayavira, Subramaniam, Srirekha, Suganya. Wonderful, doctor. I'm so happy to see all you guys. So, after this session is over, we are going to keep the recorded video in the courses. So, take opportunity to subscribe to the courses. You have a lot of MCQs, 70,000 MCQs as quiz tournaments, flashcards, then video library, and daily classes are also backed up over there. So all these things are there, flashcards, everything. So please take opportunity. 3 months subscription will cost you just 5,000 rupees only, right? So please do take every opportunity to subscribe to our online um, session. I mean, the courses on the Wongo app. Now, a 5-year-old boy, Duchenne's muscular dystrophy, once more, the anesthetic of choice. This is one of the favorite question on the different clinical scenarios. What are the various anesthetics of choice is a favorite question. Question number 17. A 5-year-old tonsillectomy on the day of surgery, he had running nose, temperature 37.5, dry cough. So, which of the following is best in this scenario? 5-year-old, very important clue. So you cancel the surgery for 3 weeks and put the patient on antibiotic whenever you are expecting infection is what you have to basically remember. So surgery should be postponed if there is any evidence of acute infection. That's the most important point, which is the carry home message in this question. Good. Durga JD Ramesh SK. So you're doing really good. Now, question number 18. 18. Postoperative nausea and vomiting following squint surgery in children. How do you treat it? How do you treat it? Is a very important question. So, what do you use to treat the postoperative nausea and vomiting? So, all of you know we use the ondansetron. Even propofol, dexamethasone, they're also used in the treatment of postoperative nausea and vomiting, is what you have to emphatically remember. Most of you have gone wrong. Only Sudarshan Mahanta correctly answered. Absolutely great. Question number 19. So, a child is posted for operative repair of exotrophy of the bladder with renal failure. Wow. So, what is the anesthetic which is preferred? So, you should know what is the muscle relaxant preferred in children, induction agent preferred in children, analgesic preferred in children, etc. etc. So, atracurium is the one which is preferred, especially with renal failure. That's a important buzzword that you need to remember. JD is absolutely right. Very good. Now the question number 20. Question number 20. Yeah, good to see 7 of you being online. Excellent, doctor. So please inform, please kindly drop one small audio or a video acknowledgement or testimonial. Hey, I'm attending this anesthesia quiz with Dr. Murli Bharadwaj. You also come and join. You just put a word in that WhatsApp group where you are. And that means a lot for us because our students are our best brand ambassadors who do all the job to do the word of mouth marketing for us. Right? So, doctor, so let's take up the next question, number 21. In a case of road traffic accident with head injury, BP very low, 90/60, pulse 150. Obviously, which anesthetic is good in this scenario in a head injury, which is a very, very important clue for the tomorrow's entrance. Thiopentone is the best agent in this given scenario, is what you need to remember. Good. Durga correctly answered, SK also, Raj also. Beautiful, beautiful, doctor. Then question number 22. So what is contraindication in an epileptic patient? Is a very important question. Contraindication in an epileptic patient. Yes, doc. Super. So ketamine, there are a list of contraindications for ketamine, which you have to be 100% sure about, doctor. Very good. Now, 23. Splenic rupture is there, BP very low. What is the induction agent of choice? So once more, a classical, traditional question. Yes? So what is the induction agent of choice? Very good. Etomidate is considered to be the induction agent of choice is what you should remember. Good. Durga, JD are rocking. Question number 24. 24. Yes. So coarctation of aorta. Once more. Cardiovascular conditions. What are the anesthetic agents of choice and techniques of choice? Is the favorite question of the examiner. So, in coarctation of aorta, patient general anesthesia is always safe, controllable, and easy to manage the hemodynamics. So, good. Question number 25. Cyanotic heart disease, planned for corrective surgery. What is the induction agent? Once more, cyanotic heart disease. In a patient of cyanotic heart disease, what's happening? Right to left shunt is happening. So anything that make the left side total peripheral resistance to rise will reverse the shunt back into left to right. Do you want right to left or left to right? You always prefer to have left to right. So cyanotic is right to left. So right to left one, you want to push it left to right, you need to increase the systemic vascular resistance. That happens with ketamine, which is a vasoconstrictor, is what you have to fundamentally remember. JD, correctly answered. Question number 26. PDA, congestive cardiac failure, you decided to ligate the ductus arteriosus. So, minimal hemodynamic alteration causing induction agent is which one? Yes. First of all, is a child. Child means sevoflurane. Child means sevoflurane. Very good. JD, Sudarshan, Mahanta, Raj, correctly answered. Beautiful. Question number 27. The most common cause of the mortality in a patient undergoing major vascular surgery is what? Most common cause. So why vascular surgery patients will suffer? So vascular surgery patients get cardiac complications because heart is another major vessel, like vessel pump. That's the point you need to appreciate. So most of you, it has gone a bouncer. Question number 28. 28. Triple vessel coronary artery disease, poor left ventricular functioning, and you want to do CABG. So for maintenance of anesthesia, which is the preferred one, maintenance of anesthesia. So typically, whenever anesthesia is being given in a patient of heart disease, you look how is the left ventricular function. If the left ventricular function is poor, then you give high dose opioid anesthesia. And it is mixed with intravenous and inhalational anesthesia. And don't use vecuronium with opioids because opioids can lead to bradycardia, and if you combine the vecuronium with opioids, that bradycardia worsens is what you need to basically remember. So this is a little googly. So it's difficult to answer unless you are a specialist in anesthesia. Now, aortic arch aneurysm under deep hypothermic circulatory arrest. So, which anesthetic agent provide cerebral protection? Interesting question. You can easily remember thiopentol and all what seizure medications. So that is the reason thiopentol is the one which provide the cerebral protection is what you have to remember. Good. Durga JD, absolutely right. Question number 30. Mitral stenosis patient is having surgery tomorrow. There is some liver compromise. Then what is the inhalational agent which is being preferred? Is a very, very interesting question. So, doctor, remember, anesthesia like subjects, maximum 500 points will be there. If you master these 500 points, any damn entrance exam you go, like a parrot, you have to answer. There is no intelligence required. No guessing will help you, right? No shortcuts will help you. You have to solve those 500 questions. That's the only secret. Okay. So, but it's very scoring anesthesia. 4 questions will come. 4 out of 4 you can answer correctly and come out. Right? Even on elimination, you can answer a lot of questions. So please don't forget, evening 5 o'clock to 6 o'clock, we have a general medicine class. And after that, Dr. Murali Bharadwaj will revise you anatomy 6 to 7, 7 to 8, 8 to 9, 9 to 10, 10 to 11, 11 to 12, continuously one after the other. You have wonderful teachers. We have a very wonderful teacher called Dr. Hairmath. So she is an obstetrics teacher. She is going to take a great class of 40 questions discussion. All are MCQ based discussion for the PG entrance preparation. Right? So please take every opportunity while you are studying. Click of a button, you are inside the video room. Right? So wango.ai should be there on your Google Chrome bookmark. Every time you get time, click on that, get into the room, enjoy a lovely companionship of wonderful teachers who will be blessing the every 1 hour of class to add a lot of confidence and boost Bornavita, Horlicks to your preparation. Now, to control the heart rate intraoperatively, what are the various agents which are used to control the heart rate intraoperatively when surgery is going on? So anesthesia is one beautiful, you are like a Air Force fighter pilot if you are an anesthetist. So you are controlling everything. The success of operation is the success in the hands of anesthetist more than the surgeon. सर्जन का क्या है, अगर नहीं मिले तो सूचर बना के बाहर निकल जाते हैं. But anesthetist is the one who is an unsung hero. So Dr. Propranolol, esmolol, procainamide, they're all used in controlling the heart rate intraoperatively is what you have to basically remember. Now, not the calcium channel blocker. Always calcium channel blockers are negatively inotropic. Remember that. Question number 32. 32. Yes. Vasopressor of choice for aortic stenosis developing hypotension during surgery. So these are all specific clinical scenarios, doctor. There will be small reason behind everything. So it is a phenylephrine, which is the anesthesia vasopressor of choice in aortic stenosis is what you need to basically remember. Always remember, a fall of total peripheral resistance. A fall of total peripheral resistance typically worsens all the stenotic lesions and improves all the regurgitant lesions. That is the important principle that you need to remember. Now, question number 33. Infected tooth posted for extraction. So, what is the best agent? Typical dental वालों का question है. Yes. So, infected tooth posted for extraction. Enflurane is the one which is being preferred. Good. Durga crossed 1,000 points. Excellent, excellent. Question number 34. So, whenever you take this like a quiz along with others to fight, compete, and deliver, then you will remember it. Fire breaks, fire breaks out during laser vocal cord surgery. Then what is not to be done? So, laser vocal cord surgery. So you can pour sterile water, remove endotracheal tube, treatment with steroid and antibiotics. They're all okay. But when fire is there, don't add oxygen to it. Right? So, simple common sense question. Very good. JD also touched 1,000. Let us see. JD versus Durga. Who is going to be the winner? Once more, doctor, don't forget, evening 5 o'clock, we have the general medicine class by one of the second year MD, recent NEETPG topper, excellent teacher. So please join the session. Sensory block for lower segment ciliary section is given at the level of the T4, one of the traditional questions. Wow, good to see Suganya, Javed, Jabiullah, Sri Rekha, Subramaniam, and many more who are all online. Good. Question number 36. So please inform your friends in the WhatsApp groups, Telegram groups here and there. Wango.ai is our website, and make as many number of your friends also join, register. After all, it is free. So, what is the important factor deciding reduced dose of anesthesia in pregnancy? So, it is the mechanical factor, right? So, it is the mechanical factors, hormonal factors, altered pharmacokinetics. So, they're all the deciding factors. Good. Question number 37. In pregnancy, there is a decreased requirement of anesthetic agent. What is the reason? Reason, except why there is a decreased requirement of anesthetic agents. So, because there is a decreased lumbar lordosis. So basically, in the pregnancy, there's a higher sensitivity, engorged spinal veins, decreased subarachnoid space. They all will decrease the requirement of the dose of the anesthetic agent in pregnant women, is what you have to basically remember. Very good. Durga, Ramesh, and Raj, Anil, all of you are absolutely right. Question number 38. 25-year-old primigravida, mitral stenosis, and mitral regurgitation under labor. She wants a normal delivery. So, what is the best way to provide analgesia in this lady is a very important question. Yes, doctor. So, the best way is neuraxial blockade. Analgesia is the one which is being preferred. So, epidural is neuraxial. Epidural blockade is neuraxial. That is the one which is preferred. There are many reasons when it comes to cardiovascular outcomes of epidural. So, you need to have a little deep dive into that. But anesthesia, psychiatry, dermatology, radiology don't have too much of deep dive. There will be about 500 to 1000 facts. If you master it once, more than enough. MD में सीट आने के बाद देख लेंगे. 25-year-old primary gravida, mitral stenosis and mitral regurgitation under labor. Once more, labor, pregnant, all these things you should think of epidural blockade. Good. JD and Durga are closely trailing. Let us see who is going to be the winner of the overall game. Right? So, question number 40. You want to manually remove placenta. What is the anesthesia of choice? If you want to manually remove the placenta. Beautiful question. Yes, doctor. What is the anesthesia of choice for manual removal? Yay! Very few answered correctly. General anesthesia is the one which is preferred. Even Durga, JD were clean bold. Anil correctly answered. Sudarshan Mahanta also correctly answered. Beautiful. Now, doctor, question number 41. Alcoholic liver failure patient requires general anesthesia. So, what is the agent of choice? Agent of choice. Alcoholic liver failure requiring general anesthesia. So, it is the isoflurane which is the one which is preferred. Wow, JD correctly answered and JD is on the top. See, competition, how it keeps changing. So, question number 42, still 4 questions for Durga versus JD. All anesthetic agents decrease the portal vein flow. So, portal flow is maximally reduced by which agent? Is an important question. Maximally reduced by. Very good. So, it is maximally reduced by halothane is what you have to remember. Both JD Durga, but Durga answered very fast in a snap of second, getting more number of marks, right? So also Anil correctly answered, Javid Jabibullah also correctly answered. Excellent, doctor. So thank you all guys for joining the quiz, So be part of our WhatsApp group. Every time new programs are happening, also keep an eye on the wongo.ai, right? You keep getting the alerts. Even our mobile app, the mobile app is getting ready in a couple of days. The Android app, then you will have a lot of fun. Mobility will be there for you. So, question number 43. 43. Renal disease. What is the anesthesia of choice? Anesthesia of choice. So, liver disease, renal disease, all these conditions you should know. Right, doc? So, in renal disease, so of course, there are multiple agents which are preferred in the renal disease, is what you need to remember. Now, question number 44. So, once more, anesthesia of choice in renal failure. This is the correct question, actually. So, it is the isoflurane, which is the one which is preferred. JD correctly answered and reached the top. The last 2 questions which are going to decide who is the winner of this today's evening. Anesthesia in status asthmaticus. What is except about it? Status asthmaticus. So, what is except about it? So, always in pulmonary disease, ketamine, because it's a bronchodilator, is the preferred one in adult, halothane in the case of the children. All right. So, these are 2 points you need to remember. And whenever you are operating on asthmatic, then there are certain drugs that you are contraindicated. Please don't forget that list. Beta blockers, althacin, opiates, barbiturates, benzodiazepines, they're all basically contraindicated. Beautiful, beautiful. So most of the people, it is a bouncer. The last question of the evening. I hope this is a good, strong dosage of inspiration for you while you are preparing. So don't forget, evening 5 p.m. to 12 p.m., 7 hours. One after the other, you have a marathon session. You are going to bring your friends also, not only you, your friends also to join those marathon sessions. I am going to personally deliver 6 to 7 anatomy, ekdam garma garam revision. So please do join the session. So during rapid sequence induction of anesthesia, pre-oxygenation is the one which is mandatory. Wow! JD, 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 JD. Excellent, doctor. Excellent. But also, I thank Durga, SK, Ramesh, Anil, Sudarshan Mahanta, Rituraj, Arul, Ashu, Abhishek, Jayavira, Suganya, Subramanyam, and many more who all joined this wonderful session. And let us make learning memorable. That is the whole idea. No tension, no worries. You can enjoy, and please be part of the Wongo.ai WhatsApp study group. Thank you.